My name is Melanie Kennedy. My student ID is 3178019, and this video is for veterinary nursing care, fall 2019, and that's Vtht 2439. Alright, so when you're doing a physical exam, you want to make sure you're listening to their heart, listening to all quadrants of their chest, so you're listening to all of their lung sounds. I'm going to start with listening to Frankie's heart. So I'm going to place my stethoscope just behind his left elbow here. And first I'm going to listen for any arrhythmias, any murmurs, anything that might indicate a congenital issue or onset of heart disease. This can be a good way to catch things early before they start having other clinical signs like coughing, or exercise intolerance, other things that can follow with worsening heart disease. So I'm just going to get a count for his heart rate real quick. So I got 35 beats over 15 seconds, which means his heart rate is about 140 per minute. Then we're going to listen to all of his lung sounds, listen to his chest quadrants, and I'm listening for crackles, wheezing, things that might indicate pleural effusion, or any kind of respiratory distress, any sort of issues with his lungs. Alright, and I'm hearing air moving but no crackling or wheezing. I need to listen to your other side. Oops. You're alright. And now I'm going to listen to the other side. His respirations are about 45. Normally you would like to have him sternal. It's a little easier for his lungs to fully expand when they're sternal, but Frankie is most comfortable in dorsal recumbency, so that's how we get him to be cooperative. But his heart and lungs sound normal. So we're going to set Cassie up for an ECG. We have her in right lateral recumbency. So I'm doing my right lead to her right foreleg, and black lead to left foreleg, and lastly my red lead is going to her left hind leg. And I'm going to use alcohol just to make sure I'm getting good contact with all of my leads. You want to make sure that none of your wires are crossing with anything else to make sure you don't have interference. Alright, now you can see here she has normal sinus rhythm. So all of her QRS complexes are appropriate size and width. And everything looks pretty stable. So since Cassie's EKG was largely normal during her dental procedure, I wanted to show an abnormal EKG. This is from a toe amputation that we did the other day, and shortly after inducing anesthesia when we were getting set up, this dog, Senna, had a series of VPCs, which are ventricular premature complexes, and you can see there just about every QRS complex, so just about every beat has a VPC. And so we, she had blood work prior to the procedure, which was all normal, no electrolyte imbalances or anything like that, no history of any heart disease. We did administer 1 cc of atropine, which seemed to resolve the VPCs, and she continued to have sinus rhythm for the remainder of the procedure. So at this time, we're not recommending a cardiac workup, but it is something that was noted in her medical record and something that we'll keep an eye on if she does have another procedure or begins displaying any issues or symptoms of cardiac disease. So this is our rabies pole or catch pole. So you can use this for aggressive animals if you need to restrain them, but don't want them to be able to get close enough to bite you, because on a slip lead like this, if Buster wanted to turn around and bite Chelsea, he could. So you want the loop to be fairly loose, enough to get over their head, and then you just tighten it around their neck so it's tight enough that they can't slip out of it, but you don't want to be choking them. And then for this one, you just turn the handle and it locks in place. And now he can't turn around and bite me because I have the distance of the pole between us. And then to loosen it, you just untwist the handle and slip it back over their head. So this is our neutral disinfectant. It's from Cintas. It's what we use as our kennel sol, as our kennel disinfectant. So I'm just going to spray the top and all back and all the sides of the kennel. And make sure I spray the door as well. Alright, and then we're going to let that sit for 5 minutes and then come back and clean the kennel. Alright, so it's been 5 minutes, so I'm just going to spray everything once more just to loosen everything up. And then I'm going to start at the top and make sure I'm wiping every surface. And then I'm going to do the sides next. And I'm cleaning from the top down, just so that I'm cleaning the bottom surface last, so if any contaminants were to fall down from the top or any of the sides, they'll be cleaned up when I clean the bottom of the kennel. Look at the front, clean the latches, and then the last thing is going to be to clean the door. And I'm going to clean the inside and the outside. Okay. So the Schirmer tear test tests for tear production to make sure they're not under or overproducing tears. And you don't want to touch the strip with your hands because the oils from your fingers can interfere with your test results. So I'm just going to bend the end. And we're just going to take it right into his lower lid. Here. You're all right. Alright, and we're just going to wait for 1 minute. Good boy. And holding their eye closed can help keep them from blinking and knocking the strip out. Good boy. Almost done. Almost done, buddy. Good boy, Buster. Good boy. Easy. Good boy. Enough. All right.
That was a good boy.
And so his reading is just about 20, which is within the normal range. Anything lower than 15 is starting to be concerning. Lower than 10 is definitely too dry, and then anything greater than 35, they're overproducing tears. And you always want to test both eyes. Okay. And before I do my tonometry, I'm going to use tetracaine to numb his eyes. So I'll just do a drop in each eye. And then we'll wait 2 to 3 minutes before we do the Tonopen. So I have my Tonopen with a clean cover on it, and I'm going to calibrate it. So with the tip pointing down, I'm going to hit the button twice. And it says calibrate. And within 15 seconds, it should direct me to flip the Tonopen up. And then it says it's good. So we're gonna go ahead and check Buster's ocular pressure. Good boy. And got a reading of 15, which is normal. And we'll go ahead and check the other eye. And that one is 38. So we gave Buster a break for a minute, and we're gonna retest the pressure in that eye since that reading was a little bit high. All right, and now I'm getting a reading of 15. So the main thing that would cause an increased intraocular pressure would be glaucoma, which he doesn't have any of the clinical signs for that. So it also could be just the restraint that caused temporary increased ocular pressure in that eye. Okay. So I'm going to do my fluorescein cleaning now. I have my stain strip. I'm just going to apply a few drops of the ophthalmic wash. And just stain his conjunctiva. I'll let him blink a few times. And wash out any excess stain. And then we're looking for any stain uptake on the surface of his eyes, which would indicate a scratch or ulcer. I don't see anything obvious. I'm just going to turn the lights off and check with my ophthalmoscope. And not seeing anything. so he doesn't have any injuries to the surface of his eye. So for internal anal gland expression, you're gonna lift the tail. The anal glands are generally around 4 and 8 o'clock inside. So I have some lube on my gloved hand. I'm gonna insert one finger and then feel for the anal gland, and I have it between my forefinger and my thumb. And then you just kind of milk it towards you with light pressure, almost like you're squeezing a tube of toothpaste. Right, bud.
He's a good boy.
All right. And then I'm going to rotate my finger and do the same thing on the other side. All right, and that was fairly thick content, so that's why he was a little bit uncomfortable, but both anal glands expressed easily, so now we'll clean up his rear end, and he's all set. So I'm preparing my soapy water enema, so I have my dish soap, and I'm going to add some of our lube and warm water. And just mix everything together. And then I'm going to draw my enema up into the syringe. So we're not going to use this whole volume on Coco because she's so small. And then I'm going to touch my red rubber catheter, and I'm just going to flush the catheter real quick. And then we're not going to insert the enema tube very far. Only about 2 or 3 inches. And then I'm just going to inject some of my enema solution. So we're going to apply topical revolution. So I'm just going to snap the cap down to open the tube. And then I'm going to part the hair at the base of her skull because I want the revolution to go directly onto the skin, but I want it to be somewhere that she can't lick it or reach it with her paws to try and wipe it off. So we're just going to part the hair so I can see the skin, and I'm just going to apply it directly to the fur. We're going to do ear cleaning, so I'm going to lift up the pinna to straighten his ear canal and massage the cleaner. And then use my cotton tip applicator to remove debris and discharge from his ear. So I'm not getting very much out of this ear anymore, so I'm gonna go ahead and medicate with Claro. And again, I'm gonna pull his pinna up to straighten his ear canal. And then massage his ear. And then we'll do the same thing for the other ear. And he has chronic skin infections, so his ears are kind of deformed just with the swelling and thickening of the skin.
I'd do the right ear too.
So now I'm gonna medicate the right ear as well. So we're going to clean Toast's ears, and I'm just going to soak a few gauze squares with my ear cleaner. And gently massage her ear. And I'm just going to apply a little of the cleaner into the ear canal and massage the base. make sure I'm wiping her pinna and all the folds. And I'm not getting a lot of debris from that ear, so I'm going to go ahead and apply a drop of the medication. Just right down into the ear canal, and then massage the base of the ear. And then same thing for the other ear. And then I'm just going to apply a drop of my truth serum. Okay. So to administer sub-Q fluids, you want to use a larger gauge needle, like an 18 or 20, and you want to go right in the scruff here, and just tent the skin and insert your needle. And then I'm going to open up my fluid line. And you can kind of adjust the needle so it's flowing well. And then you just administer whatever the doctor has recommended. For cats and smaller dogs, it's generally around 75 to 150 milliliters, but you never want to overfill the sub-Q space because excess pressure can cause tissue necrosis. So you never want to force fluid into the subcutaneous space or overfill so that this area becomes firm. And then when you're finished, you just close off your fluids. And then you want to pinch the skin where you're pulling the needle out and just hold it for a few seconds to make sure that the fluids don't leak. So we're gonna do a nail trim on Buddy. And he has clear nails, so you can see the quick here, this pink part of his nail. And when you're doing a nail trim, you don't want to clip the quick because then they will bleed and it's very painful. So we're gonna cut just in front of the quick. And on dogs with black nails, they tend to have this kind of hook right after the quick, so you can use that as your guide of how short to cut. And then get their dew claw. And if I were to cut his quick and his nails were bleeding, then I can just use some of this Vtht and apply it right to the end of the nail that's bleeding with some pressure, and that'll stop the bleeding. Right, so for my cat nail trim, you're gonna push on the paw pad to extend their nail, and then you just wanna cut just before the quick. And make sure you get the dew claws as well. And if you do cut their quick, you can apply Vtht or styptic powder to stop the bleeding. I'm going to demonstrate an abdominal pressure bandage. So this would be if he had a wound or an abdominal incision and we wanted to keep swelling down, or if he had discharge from an incision and we were trying to bandage it. So I'm going to start with a non-stick Telfa pad and just place that right where his incision would be. And then I'm just going to start around his rib cage with cast padding and apply a decent amount of pressure. And since he is a male, we want to avoid bandaging his penis. It's still very hard to keep abdominal bandages dry, but we don't want to tuck his penis into the bandage because that won't help. do my conform gauze. And I'm overlapping each layer. And since it is a pressure wrap, I'm applying a good amount of pressure to this layer just to give me some compression for my bandage. And then my last layer is going to be my vet wrap.
Passing your urinary catheter.
And since he has a fairly deep chest, you can use a layer of elasticon around his rib cage to help keep the bandage from slipping. So I'm going to overlap about 50% on the bandage and then 50% on his fur. Right, and to remove my bandage, I'm just going to peel off this elasticon layer. And then I'm just going to cut the rest of the bandage off with my bandage scissors, just one layer at a time. So we'll do the vet wrap layer. And then my conform gauze. And lastly, my cast padding. And I've got my Telfa pad in there too. So to manually pill a dog, if you're having a hard time getting them to take their pills, or they won't eat up in a treat or anything, what you want to do is take the pill, and then you're just going to grab their top jaw and hold down their lower jaw and place the pill at the back of their throat, and hold their nose up until they swallow, and then make sure they don't spit it back out. Alright, so to pill a cat, you're going to want to hold their maxilla with one hand and then pull down their mandible with the other and put the pill toward the back of their throat. And then you want to hold their head up until they swallow. Good girl. So for my modified Robert Jones bandage, I'm going to start with my stirrups. So I'm going to apply tape to the distal third of his leg and use a tongue depressor to keep them from sticking to each other while I do my bandage. And then my first layer is going to be cast padding. I'm going to start at the distal end. And I'm going to leave the middle toes exposed so that we can monitor for swelling. And I'm going to overlap by about 50% as I go up the limb. And I'm applying some light pressure, but not too tight. And you want to do at least 2 layers of your cast padding. Then my next layer is going to be my compression layer. So this is conform gauze. I'm going to start from the distal end again, overlapping by about 50%, this time with a little bit more pressure. But still not too tight because we don't want to cut off circulation. And this is where I'll remove my stirrups or apply them to the bandage. So I'm going to twist them so the sticky side is facing my bandage. And then apply my splint. And then we'll just do one more layer of the cling gauze to keep that in place. And if Buster were to actually have an injury and need to wear this splint, we would trim off the excess here. But you want to make sure that it fits, their leg sits right in the splint, but it's not too big, so they don't have a lot of access room to move around. And then my last layer is going to be my vet wrap. So I'm going to start just above the most distal portion of my cast padding. And then again, overlapping by 50%, move my way up approximately. And I'm not applying much pressure at all for this layer. I'm going to leave some of my cast padding exposed at the top as well because the vet wrap can cause irritation if it's in direct contact with the skin. Alright, and then I still have my toes exposed so I can monitor that for swelling. And now I'm going to demonstrate how to remove the bandage. So you want to remove it one layer at a time. So using my bandage scissors, I'm going to start with my vet wrap layer. fine foam gauze. Remove my splint. And I'll pull down my stirrups. And then my last layer will just be removing the cast padding. And then removing my stirrups. And the other one came off with my last layer of the cast padding. And that's it. So this 407 tooth has a carie on the distal aspect, so we're going to x-ray that tooth. Step out. Alright, and as you can see, that tooth is resorbing, so that's going to have to be extracted.
Here we go.
So now we're going to x-ray the maxillary incisors. And line my unit up. And we have all our incisors there. This way I don't think I don't. Okay, so these are instruments used for manual hand scaling. The straight ones you're going to use on the more rostral teeth up here, and the curved one is more for the premolars and the molars. So you just use the edge to kind of chip away at the tartar. But you don't want to use these below the gum line.
His dose for his medicine.
For the ultrasonic cleaner, you're going to use just the side along the tooth. And you don't want to have contact with one tooth for more than 10 to 15 seconds, because the ultrasonic cleaner can get really hot and it can cause damage to the surface of the tooth. And you also want to make sure you're using the side and not using the tip at a 90-degree angle to the tooth, because that can also damage the surface of the tooth. So I'm going to polish the teeth with Prophy paste now. The Prophy paste is used to smooth out the surface of the teeth from any rough patches that might be left over from the cleaning. If you leave the teeth rough, it allows calculus to build up much more quickly. So you want to get all the surfaces of all of the teeth and make sure that you have plenty of prophy in the cup for each tooth. And you want to get the whole surface. And then once you're done polishing, you can rinse the mouth out with water. Okay, so I'm going to go over at-home dental care for your dog. So what you can do is brush their teeth just with a regular toothbrush. And you're going to just use water, not any toothpaste on the toothbrush. That way they won't try and chew on it. And you just want to use it at a 45-degree angle right along the gum line. And just brush all their teeth, particularly the teeth back here, the bigger molars. That's where they tend to collect a little more of the tartar. And once the tartar starts to build up, it's easier for more to grow on top of that. So if you can keep ahead of it, that'll help. And you can also use dental chews. So these are one option. They're just kind of a long, hard chew. And then there's also, these are an enzymatic rawhide chew. So those can help keep their teeth clean. You definitely want to make sure that they're not chewing on the rawhide for an extended period of time, so 20 to 30 minutes, and then you can take it away. If they still have some left, you can just save it for another day. And they also make several kinds of enzymatic toothpastes that you can use. Just run it along their gums with your finger after you brush their teeth, and then they can kind of just move it around with their tongue and lick it and keep everything clean.
Okay.
Do you have any questions?
I think that's it. Thank you.